Welcome to the Explainer. In this explainer, we're breaking down the incredibly complex journey of scoliosis. We're going to turn it into a clear, actionable roadmap, essentially handing you the map you need to navigate the critical decisions ahead.
So, let's kick things off with a pretty powerful question. Just imagine, what if you could see all the potential destinations of a journey before you even took that first step? Well, for so many families facing a scoliosis diagnosis, that's not just a hypothetical. It's the reality of the choices they're about to make.
So, look at this. On one side, you've got a journey that starts with a pretty mild 33-degree curve. But on the other, a possible destination? A severe 88-degree curve that's going to need some complex surgery. This isn't just a set of numbers. It's a story of two totally different paths. Today, we're going to break down the roadmap that connects them and show you how you get to choose your own destination.
So where do you even start? Well, every single journey on this map begins with one thing: knowing your exact starting point. And for scoliosis, that means first recognizing the signs and then getting a really accurate measurement.
It often starts with something you can spot right at home. Maybe uneven shoulders, a waist that just looks a little off balance, or maybe one hip seems higher than the other. And the big one, a noticeable hump on one side of the back when you bend forward. These are those classic early warning signs, the little signals that say, hey, it's probably time to go see a specialist.
Okay, so once you are with a specialist, they're going to zero in on one key number that guides every single decision from here on out. And that's called the Cobb angle. It is the universal language doctors use to measure just how severe a curve is. And this number, it dictates, well, pretty much everything.
And believe me, getting this number right is everything. As orthopedic surgeon Dr. Kadir Abul puts it, a few degrees of mismeasurement can completely change the treatment plan. Think about that. A small error isn't just a small detail. It could literally send you down a completely different path on the map. That's why getting it right from an expert is the most critical first step.
Okay, let's dive into this next part, because now we're at the first major crossroads on our map. This is where time itself becomes maybe the most powerful and, frankly, dangerous factor of all. And I'm talking about the adolescent growth spurt. See, for a kid who's still growing, that curve in the spine isn't just sitting there. It's active. It's a moving target. And during those peak growth years, it can move incredibly fast. Look at this number. For a 10-year-old girl with a moderate curve, if you do nothing, there's an 87% chance it's going to get worse. That's not a maybe, it's a near certainty.
But now, look what happens with age. That risk, it doesn't just go down, it plummets by more than half just 4 years later, once that main growth spurt is over. This tells us one thing loud and clear. Timing is everything. The earlier you are in that growth spurt, the more aggressive scoliosis can be. During these years, time is absolutely not on your side.
Okay, so that sounds a little scary, right? A ticking clock, but it absolutely does not mean you're helpless. Not at all. In fact, you actually have some incredibly powerful non-surgical weapons in your arsenal to fight back and actively change your destination on this map.
And the number one weapon, the single most effective non-surgical tool to stop that curve from getting worse? It's bracing, a modern custom-fitted brace. And I'm not talking about watchful waiting. No, we're talking about proactive, hands-on intervention designed to stop that curve dead in its tracks. And does it work? Oh yeah. Just look at this story. I'd call it the warrior's journey. This patient started with a 45-degree curve at age 10, a curve that had a massive chance of getting worse. But she was committed. She wore the brace. And the result? Her curve didn't just stop. It actually got better. Way better. That's a huge win. But you gotta see the other side of the coin. This is the cautionary tale. A patient with an almost identical starting curve, but the brace wasn't worn. And you can see what happened. The curve just took off. It basically doubled in a couple of years, and it led straight to the operating room for a complex spinal fusion. The two paths could not be more different.
But here's the thing. The brace doesn't have to fight this battle alone. There's a powerful partner, kind of a secret weapon that makes bracing work even better. And that's scoliosis-specific physiotherapy, with methods like Schroth.
And when you put these two together, the results are, honestly, they're staggering. Research shows that if you add this specialized therapy to a consistent bracing plan, look at this. your chance of needing surgery drops all the way down to single digits, just 7%. That's a total game changer.
So let's be super clear about this. This combination, a good brace, worn the way it's supposed to be, plus that specialized therapy, that is the modern gold standard for avoiding surgery, period. This is how you take control of the roadmap.
All right, but what if surgery does end up being the necessary path? Well, this is important because what success looks like in the operating room has totally changed. It's not what it used to be. You know, back in the day, the goal was pretty simple. Get that spine on the X-ray to look as straight as possible, even if it meant fusing a huge section of the back. But today, the goal is so much smarter. It's about creating a spine that's balanced, yeah, but also mobile. It's about preserving function for the rest of a patient's life. And Dr. Abul just nails it with this quote. He's not talking about how straight the spine is. He's talking about what his patient can do. He says, I could do bungee jumping with this patient. That tells you everything, right? Success isn't about the degrees on a screen. It's about what you can do with your life.
So, remember how we started? We asked, what if you could rewind the clock? Well, let's actually do that right now. Let's go back to that patient whose curve went from mild to severe, and let's look at all the different crossroads, all the different choices that were on the table along the way.
Just follow this path. At 9 years old, with a 33-degree curve, the door for bracing and therapy was wide open. By age 10, other, less invasive surgical options were still possible. But with each passing year, as the curve got worse, the choices got more invasive, and they started to disappear. Until finally, at 88 degrees, a really complex surgery was the only road left.
So this is your roadmap, boiled down to its essentials. These are the standard guidelines for a growing child. But I want you to look really closely at that middle zone, highlighted in bold. That 25 to 45 degree range, that is the sweet spot. That's the critical action zone where you have the most power to change the outcome without surgery.
So let's just boil it all down. First, early detection. It's your single biggest advantage. Second, proactive treatment with bracing and therapy. That's not just a treatment plan, it's your superpower. Third, your commitment. That's the fuel for this whole journey. Nothing works without it. And finally, and maybe most important of all, remember that you, the patient, and your family, you are the boss of this team. You're in the driver's seat.
A scoliosis diagnosis, it's not a sentence. It's not a path that's already been written in stone. It's a roadmap with different crossroads and different destinations. And the choices you make, especially the early ones, are what pave the way forward. You have the map. Now, which destination will you choose?